Hi, I'm Tristan Baron, nurse practitioner and owner of Elevate Medical Spa. I specialize in advanced cosmetic injectable procedures here. So today we're going to talk about one of those advanced procedures, and that is the non-surgical nose job, also known as liquid rhinoplasty or nose filler. A couple different terms for it. So how does it work? Non-surgical nose jobs are a way where we place small amounts of strategically placed filler in the nose to help improve the appearance of the nose, whether that be the side profile, reducing a dorsal hump, or other areas of the nose that we want to just refine and look a little bit more sleek. So now I'm going to talk a little bit about how the procedure is performed. So like I said, we use small amounts of filler strategically placed in different areas to help improve the appearance of the nose. How that works is, for example, if someone comes in and they have a dorsal hump, we would actually place a little bit of filler right above the hump and slightly below the hump to create the illusion that the hump has disappeared. Surprisingly, the nose is one of the only areas on the face where if we actually add filler to it, it decreases the size. So instead of adding volume and making the area look larger, it actually makes the nose look shorter. How does that work? Because instead of our perception, when we look at someone, we think the nose starts from right in between the eyes and comes outward. By adding a little bit of filler to this area to soften this bridge, now our perception and view is that the nose starts right here and comes down. So it looks a little shorter and a little bit more feminine. Another thing that we can do that people love is to lift the tip of the nose. We do that by adding some filler to the tip to give it some support, and so that instead of it angling downward, it has a nice slope. Like I said, we of course always place small amounts of filler because we don't want to change the nose too much and we want to keep it unique and characteristic to the face. Also, I do treat a lot of people who have had a rhinoplasty in the past and maybe they weren't that pleased with their results, or there's some areas that still need to be addressed. Typically that's when they've taken a little bit too much cartilage out of the nose in the bridge area, and we can add a little bit of filler to help fill that in and create that nice, smooth, straight look. So next we're going to talk about what to expect when you're in the chair for your non-surgical nose job appointment. First, we take some photos. The photos are key with this procedure, especially because most of the impact and changes that we are making are from the side view, which we don't view ourselves from the profile, like laterally. We see ourselves front on all the time, but actually the majority of the population, our friends, our family that we hang out with all the time, they see us from the side. So we take some photos of the profile of the nose and the face, and then we apply some numbing cream to make sure that you're numb in the area and that we minimize the pain as much as possible. Once the numbing cream has sat for about 10 to 15 minutes, we sterilize the area and clean it with hypochloric acid and with alcohol, and then we go in and place those small amounts of filler. I would say the injection time itself is very minimal, maybe 5-10 minutes max. And it's pretty comfortable. Most people don't have any issues with it and rate it on like a 2 or 3 out of a 10. Now afterwards you might be a little sore, a little red, a little tender to the area, possibly bruising. We try to minimize that risk, but it's always a possibility. One of the most important things to understand about the non-surgical rhinoplasty or the liquid nose job is it's a very high-risk procedure. It shouldn't be taken lightly, and it should always be performed in the hands of an experienced, trained injector. There are a lot of things that can go wrong. Now those things are rare, but we want to minimize those risks as much as possible. So you want to go to somebody who knows their anatomy well, who can assess the area properly. They know where to avoid injections and where to place injections that are going to be safe. So last but not least, we're going to talk about what to expect after your liquid rhinoplasty. So we're going to talk about the results. The great thing about filler is it's immediate. So we're going to be able to see that result right away, and it's going to be awesome. The before and after photos are really going to show you how the improvement we've made in the profile. Next, we always like to have you come back for a 1 to 2 month follow-up. That is included in the price for this procedure, and it is very important because not only do we want to assess how things are looking and evaluate them, but I usually say about 10% of the filler doesn't take. Just naturally we swell. When the swelling goes down, some of those results might go down slightly, and then it gives me a chance to refine the result and just bring them back up to that full correction that we are achieving. So typically non-surgical nose jobs last about a year, which is amazing. It's not something that you have to do that often. I usually have people come back after their 1 month touch-up for about a year later to do their retreatment or their maintenance on their nose.